Hi everyone, my name is Peter. Welcome to this YouTube tutorial. In this section, we are going to be discussing the pharmacology of anti-seizure drugs. And today's drug of choice is Zonisamide. So in this section, we are going to look at the mechanism of action of this drug. Then we shall further look at the pharmacokinetics of the drug. And also lastly, we shall be looking at the side effects of this drug. So therefore, to begin with the mechanism of action of Zonisamide. So Zonisamide is first of all is a sulfonamide with the following structure. So this makes it qualified to be an amide. So therefore, it's an amide, and also it has a sulfate group, so it's a sulfonamide. So zonisamide is a sulfonamide. So its mechanism of action is that it's going to block what we call the sodium channels and also the T-type calcium channels. So zonisamide blocks the sodium ion channels and the T-type calcium channels. So we know that the sodium channels are responsible in the propagation of this neurofiring seen when a patient is having seizures, whereas the T-type calcium channels, these usually happen that they initiate in the thalamus. We have specialized types of cells that have these T-type calcium channels that initiate seizures, for example, in absence seizures. So therefore, when we use this drug, basically we are going to manage what we call the partial type of seizures and also partial complex and the general tonic chronic. We can we rarely give it in absence seizures, since the mechanism of action of this drug on the T-type calcium channels is not so that evident, but it at some point does help in blocking this calcium channel, the T-type calcium channels. So therefore, these are the two proposed mechanisms of action of this drug. So if we go to the pharmacokinetics of this drug, we shall see that the absorption of this drug is slow but complete. So when this drug is taken orally, it's going to take long for it to be absorbed, but still eventually it will go into the body. And its distribution, it has a low protein binding capacity. So actually it is 50% protein bound. So therefore, half of the drug is let loose in the plasma, whereas the other is bound to the plasma proteins. So the metabolism is still the cytochrome P450 3F4 isoenzyme is responsible for metabolizing this drug. And as we've seen in other videos, that this type of isoenzymes are induced by the other anti-seizure drugs we looked at, that is the carbamazepine, phenytoin, and phenobarbital, and others. So this drug is going to be affected when we give it with other anti-seizure drugs. So you should be cautious when giving it. And remember, it is a sulfur drug. During its elimination, the patient should take a lot of water. Due to the presence of this structure, most of the sulfur drugs tend to crystallize in the kidney, and we get what we call kidney stones, and this may impair our body system. So therefore, it's very important for a patient to be given or to educate a patient to take a lot of water, because this zonisamide has a higher risk of causing kidney stones. So basically that's it for the pharmacokinetics of this drug. And when we look at the side effects of this drug, we shall see that we shall have First of all, since this drug has sulfur in it, skin rash. Before I even go to the central nervous system side effects, let me first point out this skin rash and also Stevenson-Johnson syndrome. So these two are very so crucial. So if a patient develops this on the first dosing, it is better for the clinician to look for another alternative, because this may lead to very serious allergic reactions or reactions that may be fatal. So therefore, this should be cautious. So when you go to the central nervous system effects of this drug, we have dizziness, we have headaches, we have drowsiness, impaired vision and speech, depression. Since most of these drugs are amine based and they kind of try to mimic the neurotransmitters, they will block certain areas in our brain and cause other side effects that are caused by other drugs. So other side effects you can see, like insomnia, and also there's something that I had forgotten to talk about here. The half-life of this drug is about between 40 to 57 hours when given alone. When you give it with the cytochrome 50 enzyme inducers, this half-life is going to drop to around 24 to 40. I'm not clear about this, but when you give this drug with the enzyme inducers, the anti-seizure drugs that induce the cytochrome P450, especially this 3A4 isotype, so you're going to see that the half-life is going to drop from 40 to 57 to within 20s and 30, around 37, something like that. So that's really huge. It shows you how the other anti-seizure drugs affect this type of drug. So therefore, basically, that's it that I had for you today as far as zonisamide is concerned. Thank you very much for watching. This was my last video as far as anti-seizure drugs are concerned. See you next time as we discuss more drugs. Bye for now.